we're going to alleviate lower back pain and even upper back and neck pain by doing a few things. Creating more movement in the spine, opening up the hip flexors so that instead of being tilted forward and putting pressure here, we're going to be open. We're going to have a nice long spine. And I'm also going to show you a movement to just reduce that clenching feeling in a lower back if you're getting acute symptoms in the lower back. So, a few things. First one, hip flexors. You're going to put your foot onto a height, not very high, just elevating it a little bit. Then you are going to kneel down, put something under that knee if you want. The other leg is in a lunge, you're pushing through that front foot. Then you're going to tuck your pelvis. So instead of being arched, you're tucking that pelvis. Most people will immediately feel a stretch here when you do that. And then you're going to bring your whole body forward. So you're thinking about bringing your hip forward, but your torso follows. What you're trying to avoid is being here. Just leaning forward like that. That is going to increase the contraction in this. We're trying to tuck and drive forward like that. Roughly 10 is perfect. Same thing then, but you're going to bring your arm into it. So start with it at your shoulder. When you're coming forward, you're reaching. So you're going to feel just an extended stretch in that area, like so. After that, start in that tuck position again. Arms up overhead and try to arch not your lower back, your upper back, which will be a small movement. And then you're rotating left and right, left and right. That's right and left. If you're finding that you can't arch your upper back without arching the lower, just don't worry about it, just do the tuck and then do the turn. Kind of each side, as many rounds as you want and as many times a week as you want. Then we're going to do a lying spinal movement. So we're working at moving the spine from the pelvis all the way up to the neck. You're going to lie flat on your back. So watch out for a really subtle movement here. So I am first of all going to tip my pelvis forward, which lifts my lower back, and then I'm going to push my shoulders into the ground and bring my shoulder blades down, and I'm pushing the back of my head into the ground as well. From there then, the exact opposite, which will be the harder one, you're dropping your pelvis and tucking it backwards, so the pockets of your pants are going down towards your knees. That's going to flatten your lower back and your upper back, and then you're going to lift your shoulders off the ground. So I'll just do one round in silence. So from here. That one, done slowly, methodically and correctly, will create a lot of decompression of the spine and will help pain all the way up that from your hips to your neck. If you're getting acute lower back pain, we're going to try this one, which should get rid of that pain, that kind of hypertonicity here, that just clenching really quickly. So you're going to sit on the low box, so your knees are above where your hips are. You're going to hold your elbows and you're going to slump down. So you're putting a little bit of force through your feet in this movement. Then you're going to take a deep breath, let that breath out and lower down more. Keep pushing through the floor, that's important. Breath in and release. And you're going to do about 5, and then after 5 you're going to slowly push through your feet in order to sit up and relax. So again, going down, push through your feet, take breath in and then push through your feet. With that one, you'll probably just feel that back releasing as you go, so do them whenever you need them.